Okay, so I'm going to go over the principles. And the first one is motor reorganization after injury requires use. This basically means that you have to work at gaining voluntary control over an injured area so it can heal and regain its function. As the book says, use it or lose it. So if you're not using it voluntarily or using it very little, it's not going to come back to be normal. Compensation requires that speech production becomes conscious. Speech needs to be highly conscious, or the person needs to be very aware of their speech in order for improvements in therapy to succeed. The next one is increasing physiologic support should receive initial consideration. The functions needed for speech should be the first priority before the behavior management. So once you know that you've done everything you could to help with their speech, if it's still not, then you can do behavior management to further their communication. The next one is principles of motor learning should influence the structure of speech-oriented and communication-oriented treatment. Slow and steady. Start slow so that there's meaning to the learning. It could take days, weeks, or years for speech or communication to become more automatic. The next one is improving speech. Improving speech requires speaking. The patient has to speak in order for their speech to improve. My theory on that one is practice makes perfect. If you're not speaking at all, you're never going to see any improvement. So you have to be trying to speak. Drill is essential. So my take on this one was practice, practice, practice. The more practice the person has, the greater the chance of lasting neuronal changes that are important for motor learning. So just drill, practice, practice, practice. The next one is instruction and self-learning each have value. The patient needs a lot of practice by talking and figuring out some things on their own, but they also need guidance and help and instruction on how to perform some of the tasks. Because they can't, if you're telling a child, just go, they might not understand that. So you have to tell them what position their tongue, their lips, all of those things need to be in to produce that sound properly. Well, these people with MSDs also need that kind of help. Feedback is important. Feedback from the therapist or even other people helps the person to realize what kind of mistakes they're making, what they're doing, because they might not see that, so that they can improve that. Specificity of training and salience are important. Strength training and motor learning are both of equal importance, but saliency can motivate learning because I think that's a more tangible goal to be able to speak and be understood, intelligibility, so they're more motivated to do it. Consistent practice and variable practice may have different effects. Being consistent with practice by using repetitive tasks can help with speed and more automatic responses, but variable practice is important to help with retention and generalizations. The next one is efforts to increase strength, if appropriate, should follow some rules for strength training. The way I took this was you use strength training exercises when there's a weakness, but it's not necessarily for everybody. Not everybody has those weaknesses. So if they do not, strength training isn't going to might not help them at all. Next one is a trade-off occurs between speed and accuracy. So both are important, but accuracy should come first because it helps with the intelligibility aspect. Speed can come after that. The next one is medical diagnosis and speech characteristics are relevant to management. The better the understanding of the MSD, the more likely the treatment's going to succeed. If you don't know what you're dealing with, you don't know how to fix it. In general, management should start early. I think that's true in pretty much every scenario. The sooner you start, the more likely the success of the person having their speech come back or whatever. The next one is baseline data are important for establishing goals and measuring change. So basically, the therapist needs to know where to start. They have to know where that person is functioning right now in order to set goals for improvement. Organization of sessions is important. This one's kind of obvious. You should see the patient pretty frequently in the beginning of the therapy, and then it can be cut back later on. But know what you're going to do when you get there so you're not fumbling around, wasting time, so that the person gets the most out of the therapy session. And another important aspect of this is not to see the patient right after they have done something that could have fatigued them, because they're tired and they're not going to want to work hard for you and do what they need to do to improve their speech. Individual versus group therapy. It's usually kind of important to start, especially a person with a stroke or something, individual therapy. Start with just them, so you can work on specific areas of need. And then as they're more comfortable and confident, you can move into a group setting, even with family members or whatever, so they can practice some of the things that you have been working on.